Another question, Premier. You talked about how the status quo in healthcare is not an option.
Yes.
I've had people from the government or close to the government tell
Sure.
me that they're expecting you to make some moves for greater private sector involvement in the delivery of publicly funded healthcare. What kind of stuff are you looking at doing?
Well, again, I don't even like the word private because it's really not. You're never, I'm going to assure you, I'm looking into the camera, no Ontario will ever have to pay with a credit card. They will pay with their OHIP card. But if we can take the burden and the backlog off the hospitals and have independent health centers with the same standards, the same actual docs, being able to go in there on their spare time. I'll never forget, I talked to a surgeon, and I've talked to many surgeons, and he said, Doug, my problem is I don't have operating room time. And he said his boss told him, well, just go out golfing instead of, finding another avenue, another operating room. And he says, I want to help people. I also want to earn more income. And what better place is to have a high standards? And when we talk to people out there, people don't care where they have to go as long as it has the same regulations, same top-notch doctors that are working in the hospital that may have some hours to go into another area in different facility and operating, and knock off simple stuff, not complicated. Knee replacements, hip replacements, cataracts. These are no-brainers that are backlogging the healthcare system. We have, 13 facilities now in Ontario that no one talks about. I think one of the most famous ones is Shouldice. They've been around forever. There's another one that does cataracts downtown somewhere. But we need to have facilities like that to take the burden off the hospitals there.